Hi, I'm Linda Fiumara and I'm a cosmetic plastic surgeon. Today I'd like to talk to you about the correction of tubular breasts and constricted lower poles, two conditions that are often associated and linked within the same patient, very often basically present within the same candidate for surgery. So let's have a look at a couple of diagrams to begin with. So this would represent our ideal breast shape. So as you can see, 45% of the volume of the breasts lies above the nipple areolar complex, and 55% of the volume sits below the nipple area. When we're looking at tubular breasts, this situation tends to be reversed. So there tends to be excessive fullness on the upper pole and lack of volume on the lower half of the breasts. In addition to that, the glandular breast tissue tends to herniate through the nipple areolar complex and leading to an overall pointy or conical appearance of the breasts, especially in lateral projection and profile view. In addition to that, we often detect constriction of the lower poles. That is, if we look at the line that joins the nipple to the submammary fold, down here, this tends to be a very short line as opposed to what we see in this first diagram where there's a good curvature. And normally this line is 6 to 7 centimeters. Whereas on this diagram we can see that there's quite a bit of constriction and lack of roundness and fullness on the lower half of the breasts. So the first maneuver, surgical maneuver, that is adopted in order to achieve better roundness and fullness in this region consists in scoring the gland tissue. That is, we basically we carry out a number of radial incisions within the breast tissue in order to release it and in order to encourage for the implant to expand the skin envelope in this region and achieve a better roundness in this region. In addition to this, we then work on the skin envelope in order to reduce the size, the circumference of the areola, and in order to reduce the protrusion or herniation of the gland tissue through the nipple areolar complex. And this is achieved by carrying out a peri-areolar mastopexy or areolar reduction or Benedict technique. So what we actually do is place an oval-shaped incision around the areola. We excise, we remove a donut area of skin around the nipple itself, and then we suture these two incisions together. So the oval-shaped incision is sutured and cinched in together with the areola itself. And as a result, the areola is going to be made rounder and smaller in diameter. And this induces a telescopic reduction of the breasts and reduces their protrusion and conical shape overall. Thank you for listening and goodbye.